Hello, everyone. I'm Rose Gerber, COA's Director of Patient Advocacy and Education. Thank you for joining us today. Well, anyone that watches TV or is on any kind of social media knows that it's Medicare enrollment time because there's all those commercials. And today, our returning guest is Kathy Oubre, who is the CEO of Pontchartrain Cancer Center in Louisiana. And I'm saying this kindly, Kathy. I think Kathy actually gets excited when those commercials come on. I think she gets excited when she sees all those mailers. And lucky for us, because Kathy has the skill set and the understanding of this topic to scrutinize the fine print for us, to take a look at all those promises, and to help us all make sense of it. So, Kathy, we're really glad that this topic excites you, and hopefully we're going to be a little bit more excited about it too, and hopefully make the right decisions. So for the audience today, you can see from this agenda that Kathy will be covering a lot of information in a short time. Just a reminder that we do have the slides available. Some of the highlights of what she'll be going over today are the ABCs of Medicare, what are Medigap plans, changes in Part D in 2025, the Medicare prescription payment plan, and of course, opportunities to change plans. Kathy, thank you so much for joining us today.
Oh, thank you for having me, Rose, and thank you to the folks at COA for asking me to do this. And yes, I will admit, Rose, I do get a little excited about open enrollment. It kind of came about several years ago when we saw patients choose plans not really being informed with what they were signing up for, but just picking a plan because insurance is very complicated and sometimes very hard to understand. And there's nothing worse than seeing a patient pick a plan that really does not optimally fit their healthcare needs, and then trying to work with them, during that plan year about their options, but then work with them during open enrollment period for that opportunity to pick a better plan for their healthcare needs. So with that, and Rose already mentioned, we have a lot to cover. We now have 26 minutes. And so I will, unlike last year, I will stick to time. If we don't cover everything, the very last slide of this presentation, and all the slides will be available, but the very last slide are resources that you can go to. Medicare actually has a very good open enrollment website, so I encourage all of you to look at it. They have a really good Part D website, and also COA has an entire suite of open enrollment resources. So it's actually, I believe, the first link on the page, and it'll bring you to the COA site. And you will need to register for a free account if you don't have one. But if you do that and then click on the links, it will bring you to that entire set of resources that COA offers. So with that, let's get started. All right, it's that time of year. Open enrollment started on October 15th and will end on December 7th. Mark it on your calendars. It is the exact same dates every single year. Next slide. All right, so as I mentioned, Medicare open enrollment is going on right now and will end on December 7th. If you are looking at an ACA marketplace plan, those are the dates on the slide, November 1st through the 15th of January. And lastly, Medicare Advantage has a different enrollment period, which is the beginning of the year through March 31st. Next slide. All right, so this is a dense slide, and I won't go over all of it because we have a lot of other things I feel are a little more germane to the topic right now. But just know that, there are two types of plans, fee-for-service and managed care. And within managed care, which is your Medicare Advantage, you do have to choose between HMOs and PPOs. Every plan, like Humana has, several different plans you can choose from, as well as most of those Advantage plans. The costs might be higher, the premiums, All of those things might look a little different for you guys, but you do have options. And then some just quick insurance terms, premiums, deductibles, co-pays, co-insurance, which is different than co-pays. And a lot of people get confused about that. And lastly, out-of-pocket maximums. Next slide. All right, so very quickly, there are the A, B, C's, and a D of Medicare. So Part A is your hospital coverage. If you've been paying into, the system, we say, during your working life, you will automatically qualify for A. Everyone does, but you should be able to have that as a no-cost option. If you have not, then, and it is on the Medicare site, you will pay a premium and a deductible for A. B is your medical insurance. So that's the part you use when you go to see the doctor's visit. That is what pays for your chemotherapy. That is Part B as in boy coverage. That'll also cover, any lab test, ambulance, and durable medical equipment. So if you are receiving chemotherapy and you have one of those little portable pumps that delivers your chemo, that's considered a DME device and is covered under Part B. Part C are the Medicare Advantage plans. So those are private insurance companies that have gotten into the managed Medicare space. So some of the big ones that we know are Cigna, Aetna, Humana, Elevance, which is a Blue Cross subsidiary. Lots of different companies have them. So if that's something you're looking at, and we'll talk about that a little later, please take some time to go through it, look at what it offers you. I know everyone likes the idea of, the gym membership and the silver sneakers and vision and dental, but it's very important that you take a look at those premiums, the deductibles, and make sure your physicians are in network. That's a really big deal, and that the drugs that you're on are covered. So Medicare Advantage, you are basically opting out of traditional Medicare and you are going into a Medicare Advantage plan. And that is something some people get confused about. They show up with their Medicare card and their Humana card. If you opt into a Medicare Advantage plan, you are essentially, opting out of traditional Medicare and that little card you have, and you will be going into a Medicare Advantage plan. Those plans will cover Part A, which is the hospital, and B, which is your doctor's visits and chemo. There's also Part D, and make sure that the Medicare Advantage plan you pick has Part D coverage. So that way you're covered, across the whole gamut. If you decide to stay in traditional Medicare, so you have Part A, you have Part B, you will, if your healthcare needs need it, you will need to opt into a standalone Part D plan. And Medicare has a very good site available for that as well. You log into it, you'll punch in your zip code, a couple of demographics, and a list of your current drugs that you're on, your D drugs. So that's what you pick up at the pharmacy counter, not what you would get in chemotherapy. So think, the pills that you take. So if you go in and you punch in all the little drugs that you're currently taking, the website will bring up all of the plans that are currently available in your area. It will talk to you about, those premiums, the deductibles, any co-pays that are associated with it, and a whole list of the drugs. We call it a drug formulary that particular plan would offer. Next slide, please. All right, so Medigap plans. If you opt into staying with traditional Medicare, traditional Medicare only covers 80% of your costs. So if you do have the option of, perpetually paying that other 20%. There is no out-of-pocket max with Medicare. So another option would be to look for a Medigap plan. So we call that supplemental insurance. So you would have your A, your B, and then you would look into a Medigap plan. There are many plans available. So plans are labeled A through N. Each plan is required to have the same letter and offers the same benefits. But the premiums and the deductibles will vary based on which letter and you pick. And so that talks about your coverage as well. But the point of that is to try and help defray that 20%. And so each one of them, one might cover the 20%, one might cover 15. Every plan is different. But part of those COA resources is a worksheet that I strongly encourage you guys to use, because what it does is it helps you punch in your premiums, your deductibles, and then it talks to you about your out-of-pocket costs, and it kind of helps you sit down and do the math on 1 or 2 pages. And then if you want to, talk with your spouse, talk with, a caregiver or someone within your physician's practice. Sometimes, like at our practice, we do offer open enrollment counseling. If you're interested, ask your doctor if that's something that they offer within their practice. And I'm sure they will be able to, they're not going to tell you what's best for you, because we as practices can't do that. But we can talk through with you the considerations that you need to think about when you're choosing the best plan. Next slide. All right, so when should you buy a Medigap plan? And so this is important. To qualify for it, you must be enrolled in A and B. You can buy a Medigap plan during that initial Medicare enrollment period. So right when you turn 65, you have those 3 months before and 7 months after. And, if at all possible, that is your optimal time to purchase a Medigap plan. If you do during that initial time, they can't deny you coverage. But, and it's on the little second bullet point here, third, if you wait until after that period of time, those Medigap plans may have a pre-existing condition clause that will either disallow you from being able to participate in a Medigap plan, or the plan may cost you more. And there are many states now that have laws around this. Some have guaranteed issuance that are saying they can't use pre-existing conditions, but every state will look a little bit different. So please be aware of that. Enrolling in it during that initial enrollment period, right when you start and become of Medicare age, that is the best, but you do have options otherwise. If you opt into a Medigap plan, it will automatically renew for eligibility every single year, regardless of your healthcare issues. And also, your Medigap plan can only be canceled if you fail to pay the premiums. Next slide. Oh, and I failed to mention, or I don't know if I did. If you have questions, please put them into the chat function. If we don't have a chance to answer them all day, I will do my best to, email them to Rose and, but please, if you have questions, please let us know. All right, so Part D changes for next year. These are significant, and this is what I want to spend the majority of our time talking about. I tried to be as, clear as possible on these slides, but there are a lot of nuances coming to Part D changes. So again, D is that prescription drug coverage. So, if you have been of Medicare age or you have a family or a loved one, everyone should be familiar with that famous donut hole. And it just seemed like that donut hole never ended and your cost of your drugs went on forever. So starting this coming year in 2025, everyone across the nation, and this is standalone Part D plans as well as Medicare Advantage Part D plans, you will have a $2,000 out-of-pocket max. So the donut hole is going away, and it is being replaced with a $2,000 out-of-pocket. Something else that will become effective on January 1st is this opt-in payment plan. So it's called several things. It's called MPPP, the Medicare Prescription Payment Plan. M3P, it's called a lot of different things, but it will become effective in January. And there are also some big changes coming to Medicare Advantage plans, as well as those Part D standalone plans. Next slide, please. All right, so here we go. 2025, the donut hole is going away, being replaced by that $2,000 out-of-pocket max. Please be clear, and there's been confusion around this as well. This $2,000 out-of-pocket only applies to the Part D drugs, so those prescription drugs, not the Part B stuff that you would perhaps be getting through chemotherapy at your physician's office. And this is how the new phases will work. The plan will require you to pay 100% of your drug costs until you spend $590, which is the Part D deductible for next year. Then after that, you'll have to pay 25%, and that's your coinsurance, for your covered drugs until you hit that $2,000 out-of-pocket max. And then after you've done that, you will pay nothing else for your prescription drugs for the remainder of this or the 2025 calendar year. Next slide, please. Okay. And also, it is worth mentioning, during this open enrollment period, if you are currently enrolled in Medicare, everyone should have received, it's called an annual notice of change document. So that is something the plans are required to send you. They usually go out late August or September, and they, by law, have to notify you of any changes that they are making to their healthcare plans for next year. Unfortunately, it's a little bit big of a document. My parents don't even read theirs until I read it for them. And so some of those changes could be in very fine print, maybe buried, in the middle of the document, but it is important this year, more than ever, for you to really read that thing and make sure that there are no changes. Some of the changes that we are seeing for next year, especially in the Medicare Advantage space, is that drug formularies are getting smaller. So one of the things you really need to ensure in the B side for your infusion drugs and the D side is that the drugs that you are currently taking will be on the plan that you want to sign up for next year. So several of the plans, Humana, Cigna, Aetna, those Medicare Advantage plans, as well as the Part Ds, they are starting to narrow some of the drug offerings that they have. So please make sure. We're also seeing changes in Medicare Advantage. Cigna and Aetna specifically are exiting several markets. So there are 30 counties across the US that they are pulling out of. So you might have, if you are one of those impacted people, you do have the option of rolling into another type of Medicare Advantage plan or rolling out and going back into traditional Medicare with a Part D add-on plan. So, please make sure. We are seeing the biggest changes happening in Florida, but I think there are 5 states across the US, and like I mentioned, about 30 counties where we're seeing particular Medicare Advantage plans exiting the market. So please make sure, like I said on this last slide, and another thing that we're seeing for next year are copays might be increasing, or if you didn't have a copay last year, you might have one this year. Deductibles may be increasing as well as out-of-pocket maxes. So for example, In 2024, the out-of-pocket max for Medicare Advantage Part D, well, actually the entire plan was $13,000. This year it is moving to $14,000. And then the deductible for Medicare Advantage plans was about $5,400 this past year. It is moving up to, I believe it's $5,938 for 2025. Next slide, please. All right, so smoothing. And this is where it's a lot of detail and there's a lot of nuances, and I did the best I could to think of a lot of the issues that you guys might encounter, but I'll try to go through them in the next 8 minutes. So let's do this. Open enrollment is going on right now. You do have the option of opting into smoothing right now. So this P3, all Part D plans, whether that's a standalone Part D or a Medicare Advantage Part D, are required to offer this smoothing option. So you don't have to change plans in order to have this benefit. And then some of the Part D plans, if you were in one this past year, some of them are proactively reaching out to patients if they think based on the drugs you used this past year, that you would be a good person to perhaps benefit from this smoothing option for next year. Please be clear, what this does is it would take that $2,000 out-of-pocket max. So let's say in January, you require a drug that costs the $2,000. You can opt into the smoothing at that time, and it would take that $2,000 and divide it up over 12 months. And so, I think it's $167 over 12 months. And then that's what you would pay to the plan. You will get a separate bill for this from your healthcare plan, and you would pay that smoothing option. It is open for opting in right now. It is an opt-in only program. So they don't automatically put you in it. You have to opt into it. You also have the option of opting in at any point next year. So you can opt in May, and then it would take that remaining out of pocket that you haven't paid yet, and it would take that dollar amount and divide it up over the remaining months of the year. And if you opt into next year, so, May or even January, if you decide to opt in next year, please the plans are asking for you to allow them about 3 business days to get that enrollment process finished. So please make sure if you're thinking about it, that you do it in time, so perhaps you don't have to wait a few days for your drug. If you decide to opt out at any time, which you do have the right, they are asking for about 5 business days to disenroll you from the program. If you choose to do that, they will just send you a bill. The health plan will send you a bill for that balance at the end. And this is something I want to be very clear with everyone. If you'll get that monthly payment, that bill from your health plan for the Part B, D smoothing. If something happens and you are financially having difficulty paying that bill, you get a 60-day grace period to catch up. If you can't at the end of those 60 days, the health plan will automatically remove you from the smoothing program, send you a bill for the balance, and you will not be able to opt in for the rest of that plan year. So please keep in mind with that. Also, if you opt out, or because of financial concerns, you have to opt out of the smoothing and you can't make those payments. Please, that won't end your Part D coverage. The only way you'll lose Part D coverage is if you fail to pay the Part D premium. So if you have to make a choice between your smoothing payment and your Part D payments, please keep, as current as you can with those Part D payments, because that's what's keeping your access to prescription drug coverage. Next slide, please. All right, we have 4 minutes. And I covered a lot of this already, so that's good. We can basically move on to the next slide, Drew. All right, so like I said, opt-in monthly payment from the health plan. And yes, well, I really got ahead of myself. Sorry, Rose. I was on a roll. And if
You're
you
doing,
do opt out or fail to pay that smoothing payment, you won't lose your Part D coverage. I want to be really clear with that because this is a brand new program. But just remember to pay those Part D premiums. Next slide. Okay, and we have 3 minutes left. These slides are the same as last year, so this is kind of the regular stuff that you guys should know. Are there any questions with the 3 minutes that we have left, or really 2? And I know this was a lot and I went really fast. Again, if you have questions, please email Rose. She'll get in contact with me and I'll help the best I can. And please take a look at those COA resources. They're really good and really meant to be helpful. Rose, did you want me to stop and you close out with the next last minute and a half?
Yeah, so Kathy, thank you so much. And to everyone in the audience, I know that I started off with some very lighthearted comments, but as Kathy mentioned in her opening comments, her interest in this topic, which benefits all of us, is she was really wanting the patients that she works with every day to choose the right plans for them. Because I can't think of anything more nightmarish than figuring, you're already going through something stressful, and then now you realize that what you need is not going to be covered. So Kathy, you really did a good job in a very compressed time frame. So thank you. And again, as Kathy mentioned, these slides will be available. You can definitely email me, and I will pass on that information to Kathy, because as I said, we know she likes this stuff, and lucky for us, Kathy. So thank you very, very much.
Well,
And I
thank you for
want
having me.
You're welcome, Kathy. And it's hard to believe, it's crazy that it's already December. And I really love this part of my job because I get to talk to so many interesting and knowledgeable national experts about topics that they really care about. And part of those experts for me are the 2 guests that I will have next month. And these are 2 of our CPAN chapter advocacy leaders. And they'll be joining me on a very broad overview of a lot of the work that we've done with CPAN this year. So for those of you that engage with us, a lot of times you know about our national work that we do when we go to Capitol Hill. We do events like this, virtual events, but we're also doing a lot of exciting work in our community cancer centers. So I hope you can join us next month, and you get to meet Angelina Lorello and Cynthia Prescott. One is from New York Cancer and Blood Specialist, and Cindy is from Eastern Connecticut Hematology and Oncology. So thank you all for joining us today, and enjoy the rest of your day. And thank you again, Kathy. Great job.